Welcome to The Inquiry on the BBC World Service. I'm Tanya Beckett. Each week, one question, four expert witnesses, and an answer. On December the 30th, 2019, ophthalmologist Li Wenliang sent a message to a group of fellow doctors in the city of Wuhan in Hubei province in China. He wanted to warn them about an outbreak of a flu-like illness he'd noticed among his patients. Days later, he was summoned to the Public Security Bureau in Wuhan and forced to confess to making false statements. Then he returned to work, and soon the truth of his warning became clear to everyone. There have now been over 80,000 cases in China with more than 3,000 deaths, including Dr. Li, who died on the 7th of February after having been infected with the coronavirus while treating patients. Li became a symbol of the initial refusal of the Chinese authorities to face up to the seriousness of the outbreak. But since then, China has taken drastic action to stop the spread of COVID-19, reducing the rate of new infections from thousands every day to fewer than 30. Now that the rest of the world is struggling with growing numbers of cases, in this week's inquiry we ask, how did the Chinese turn the tide of the coronavirus epidemic?
Part 1. The Lockdown.
I read some novels. Also, me and my parents play Chinese poker for at least 1 hour every day. Yeah.
Our first witness is Estelle Zhao, a news assistant in her 20s who works in Beijing. In January, Estelle made her annual visit to her parents in Hubei province to celebrate Chinese New Year.
January 18th, when I came back to my hometown, everything is fine. It's very normal. We've heard of the coronavirus in Wuhan, but according to the media and the government information we read at that time, it didn't seem very serious, so we didn't take it seriously.
Estelle arrived at her parents' home just 3 weeks after Dr. Li had been accused by the Chinese authorities of spreading false rumours. But now the Chinese government was instigating a rapid about turn. Estelle was about to find herself caught up in an astonishing attempt to stop the virus spreading.
Suddenly, there was so much information about the epidemic, and we began to suddenly realize that how serious it was. And then we saw people that went to the pharmacies to buy facial masks.
Estelle's parents live in a small city in Hubei province, all of which is now in lockdown. Suddenly, she was unable to return to Beijing, and since then the restrictions have become progressively tighter.
We can leave our building, and we can walk through the whole community.
But Estelle is no longer allowed to go to the shops. Her parents' home is on the 4th floor of a tower block, one of a group of 10 apartment buildings that make up her community district. What would happen if you tried to leave your community?
They would not allow us. Yeah, they just forbid us to go out, no matter for what reasons.
And is there a fence around the community?
Yes. We only have 2 gates of my community. So both gates have the guard and also the people at the checkpoints.
How do you feel about that, being locked in like that by people telling you that you can't go out?
It's not a good feeling when people stop you, but you just have no other ways, because if you go out, there are a possibility that you got infected by the virus. So I think I just tried to got used to the current situation.
And if the current situation wasn't strange enough, the authorities have deployed other unusual techniques to get their message across.
When we go out for walking in the community, when the weather is very good, and then there would be some unmanned aircraft on the sky, using a loudspeaker to tell us not to gather, just to warn us not to stay outside for too long.
So there are drones in the sky?
Yes.
You're laughing about that.
I think it's funny.
Why is it funny?
Because we're already under this strict restriction. We couldn't go out. We are locked down in our community. How could we go out and gather with other people? I think it's impossible, and people wouldn't do that. But they're just flying around us.
With loudspeakers on them.
Yeah.
What do you think about this lockdown? Do you think it's appropriate, or do you think it's too much?
I think for every individual, this is not a good way. But as for the epidemic prevention, this might be the best temporary measure to do it, because the coronavirus is a new virus and it has strong infection. So maybe it's the best way to cut the spread of the virus.
Estelle and her family now have to order food online and collect it at the guarded gates of her community. Like many Chinese people, she supports the government's attempts to control the outbreak, but she's also frustrated at the missed opportunity to deal with it earlier.
Most of us were upset and even angry about it, especially when we read many articles, reports by media about how the local government delayed and even hide the truth about the epidemic and causing it getting so serious. They should still face the problem and to solve it, or even to make up for it, or at least to get some punishment after the epidemic. But I think they should be punished.
Part 2. Release the force.
The roadblocks were becoming more serious, with people covered head to toe in protective gear, police pulling cars over and the like, and then they would pop in the window with an electric thermometer to make sure that you don't have a temperature.
Like our previous witness, BBC correspondent Stephen McDonnell was on his way to Hubei province just as the Chinese authorities were unleashing radical measures to stop the virus spreading. Unlike Estelle, he managed to escape the lockdown.
We drove out with the police on either side of us, lights flashing, into a nearby province.
Stephen returned to Beijing and spent 2 weeks in isolation in his flat. It was clear by now that China had had a fundamental rethink about how big a risk it was facing.
Well, in the early stages, to tell the truth, the response was pretty pathetic from government officials, especially in Wuhan City. And the problem is that under the Communist Party's command and control structure, there are many who would prefer to keep something under the rug rather than get into trouble.
Once Beijing had decided the coronavirus was a national emergency, it unleashed a vast array of weaponry to stop it spreading.
They've mobilised everything they possibly can to try and slow the spread of this sickness. That involves flying in extra doctors and nurses. It involves bringing in the army, building temporary facilities, which are sort of field hospitals, really, that can act as quarantine centres. Just gives you an idea of the resources being thrown at this.
Alongside the huge extra resources, draconian restrictions on the movement of people have been introduced in an attempt to minimise human contact. In Hubei province, where the outbreak began, 60 million people were forced to stay put. But elsewhere across the country too, strict rules have been imposed.
And so in Beijing, for example, if you're coming into Beijing from anywhere, doesn't matter now whether it's Hubei province or Wuhan City, anywhere, any country, in fact, you are supposed to be in some sort of quarantine.
The sweeping and unprecedented approach to combat the virus has shaken not just the foundations of the Chinese economy, which is now forecast to plunge into recession, but also that of many other countries around the world. There is one overarching message. Everybody is expected to commit themselves to stopping the coronavirus in its tracks.
You couldn't possibly move around China at the moment without noticing the coronavirus. Sometimes you go into a lift, you go to touch a button on the lift to register which floor you're going to, and there'll be toothpicks to use instead of using your finger to help you not touch stuff. And other places there'll be plastic put across the buttons which can be replaced to try and minimise the chance of you touching the same button that somebody else touched.
There are plenty of examples of businesses going to considerable lengths to reassure their customers.
If you order, say, a takeaway meal, it comes to your place, you go downstairs, pick it up from the first floor of your building, and on top of the plastic bag will be like a little slip of paper. And on that is written the name of the chef, the person who sort of put the order together, also the delivery driver. And next to each person, there'll be a little temperature reading to show that they don't have a fever and hopefully do not have the coronavirus.
Part of the reason that China is able to roll out such a comprehensive and restrictive range of measures is that its political structure is more centralised, more authoritarian than in other countries.
The Chinese Communist Party has quite draconian options available to it, options that other governments don't have. Big lists of everybody's details, phone numbers. It can enforce movements. It can rope in staff who are attached to each apartment block. So from the ground up, there are people all involved in the Communist Party system. Of course, that obviously can and has been used to oppress people, to abuse people's human rights. But it also does give the government considerable options in terms of community organisation.
This raises the question, has the strategy been successful simply because it's so dramatic and far-reaching and being imposed on a compliant population, or because the measures have been carefully thought through and well-directed?
Part 3. The Inspection.
I'm Bruce Aylward. I'm a senior advisor to the Director General of the World Health Organization, and I was the team leader of the WHO China Joint Mission on COVID-19.
Our third expert witness made a 2-week visit to China at the start of February and was amazed at the sheer scale and agility of China's efforts to contain the spread of the coronavirus, which, like flu, affects the respiratory system.
When it comes to flu, our working assumption is we can't stop this virus. It spreads so quick. It's a function of the virus. And that's kind of crept into our thinking in the West in general about respiratory pathogens. But here was China, which said, no, we are going to try and stop this. We don't have a vaccine. We don't have drugs. We're going to try just finding the cases, finding their close contacts, isolating and quarantining, and do that rigorously and relentlessly.
Dr. Aylward says the reason that China's response was successful in slowing down the rate of contagion was because the Chinese understood that they needed to act quickly to deal with new cases.
What they realize is with a respiratory pathogen like this, it's all about speed. You have to find those cases quickly, get them into isolation quickly. That means tested, diagnosed, et cetera, and into, a bed somewhere so that they're not infecting others. And at the beginning of their outbreak, it took 15 days. Now they've got that down to 2 days or less.
To help scale up its efforts, the healthcare system in China drew heavily on its technological resources.
They turbocharged their response using technology. And whether it was in how they managed all the data about all these cases, et cetera, how they even found them, how they got them scanned, et cetera, but also to how they manage the schooling. People keep saying the school's closed, the building's closed, but schooling is done online. The health center's closed. Well, most of the consultation, or 30-40% of it, was taken online. So they really used technology. They talked in one place where I was, which was fascinating, in Sichuan. They said, look, we were rolling out our 5G platform as this was happening. And instead of prioritizing the capital, Chengdu, our economic powerhouse, we prioritized the rural areas so that we could use this platform to help us run in real time our COVID response and support our rural communities. Just fascinating.
Getting ahead of the virus also meant redirecting key resources, making a choice as to where hospital equipment was to be deployed and how.
They made hard decisions. We will use our CT scanners for this purpose, and we will buy additional ones. And they also decided that we don't have to CT the whole person. We need a couple of what you call CT cuts of the chest, just to understand whether or not the lungs have these telltale signs or not. And at one point in one hospital, Tanya, I was trying to do the math in my head, and I stopped and I said, excuse me, to the director, how many people are you putting through that CT scanner? And they said, at the peak, we were putting 200 people a day through that.
200 people a day. What would be a normal rate?
Oh gosh, I remember there was a fantastic guy from Robert Koch Institute with us, in Berlin, and he was sitting there scratching his head and he's going, I think we put about 10 through our CT scanners a day or something like this. But again, remember, you have to change things, right? And what they said here was we don't need a high resolution. So they just super simplified it to get the key answer they needed to know, does this person probably have virus in them and they're going to infect others or not?
At what point do you think China will be able to say, this is job done?
China will never say this is job done. They've already decided that. What they are preparing for is having to live with the disease. And as I talked to mayors and governors, I said, so what are you doing? They said, we're building more beds so we have a proper isolation unit, and we're buying more respirators so we can keep our severe cases alive right from the very beginning. So here the numbers were plummeting in these places, and they were building like 1,000-bed places. And I would say, but your cases are coming down. And they said, look, we don't know this virus. It's new. We don't know what's going to happen in the warm season. We don't know what's going to happen as people start going back to work, as other countries start coming here who've had outbreaks. So we want to be prepared for a certain level of what you might call endemic disease or even a second wave. They want to be prepared for anything.
Part 4. Flattening the Curve.
Our final witness is Nicholas Christakis.
I'm a physician and a sociologist. I'm a professor at Yale University, and I direct the Human Nature Lab here.
Nicholas has been working closely with Chinese colleagues, examining China's response to the virus and how effective it's been at stemming the tide of cases.
So basically, since roughly January the 25th, nearly 1 billion people have been functionally under a form of restriction in which they've stayed at home for over 6 weeks. It's simply astonishing. It is unparalleled, to my knowledge, in the history of public health efforts that this many people have been under this many restrictions for this long a time.
The logic behind this far-reaching lockdown is to effect a sudden and dramatic reduction in the number of new cases. If people are not in physical contact with each other, the pathogen quite simply has nowhere to go.
The Chinese have been able to reduce the effective reproductive number of the pathogen from about 3.8 new cases for each existing case by an order of magnitude to about 0.32 cases for each existing case. And when you get the number below 1, that's when the epidemic extinguishes, when an infected person can no longer replace themselves by creating another infected person, the epidemic goes away.
Professor Christakis says the only sure way to be effective in shrinking the number of new cases is to force people to keep their distance from each other, not in second-guessing exactly how the virus is being transmitted.
People think that the transmissibility of a virus is some immutable property of the virus. But actually, a bigger determinant of the transmissibility of a virus is the behavior of the population that the virus is afflicting. So Specifically, the Chinese were able to reduce the spread of the virus by changing the behavior of the humans.
The mistake of the Chinese authorities was to ignore the problem at the start, an error which certainly cost it dear. However, it was then able to capitalise on its authoritarian style of government.
I'm not saying that this is a model that should be implemented or that can be implemented in other countries. It's clear that the collectivist culture and authoritarian government of China makes it possible to do this. But the fact that this much effort was required to stop the epidemic in that country should give us a sense of the opponent we are dealing with.
It may ultimately prove impossible to eradicate the virus completely, but Professor Christakis says it is within our reach to reduce the number of cases at any one time, thereby easing the burden on our health services.
We need to reduce the force of the epidemic. We need to do something known as flatten the curve. So, for example, if we are to have 1 million cases in the United States over the course of the epidemic, we don't want them all to occur in 1 month. We want to space them out over 6 months so that any given time, our healthcare system and our supply chain can cope with the burden of caring for those sick individuals.
Professor Christakis says we need to try to keep away from the doctor's surgery, follow the Chinese example of getting more of our healthcare online, and fundamentally change our social behaviour. No shaking hands, unnecessary meetings, more working from home, and the shutting of schools. The consequences of not acting quickly and decisively have been demonstrated not just in China, but now in a number of other nations.
If you look at what's happening in Italy, it's very alarming. I have been reading accounts that they have been resorting to battlefield triage. If you're older than 60 and you have pneumonia from the virus, you don't get a respirator, you just die. They don't have enough ICU beds and respirators to meet the need. Really what we want to do is we want to convert this tsunami into a slow-moving tide that allow our healthcare systems and the broader society to do its job.
China has managed to turn the tide of coronavirus infections by imposing huge restrictions on the movement of its people and sanctioning a vast deployment of resources to screen suspected cases. It's not alone in responding to the epidemic with dramatic measures. South Korea has used mass testing to curb the disease spreading. There are lessons to learn from draconian techniques. Other countries may struggle to replicate them, but it is apparent that speed is essential. It's also painfully clear that it will take some years to emerge from the shadow of COVID-19.
The Inquiry was presented by Tanya Beckett. The producer was John Murphy and the editor is Richard Vodden. The programme was mixed by Neil Churchill. If you'd like to get in touch with the team, you can email theinquiry@bbc.com or tweet at BBC The Inquiry.